kind of problems that I have just mentioned. There are rules of thumb that stem from public health, and I think they are worthwhile quoting, because we can say fewer guns on the street, fewer deaths in the town. Gun control is still a major problem, and it is a public health problem. And this is something in Greece we have not really understood. More miles driven by the fleet, more accidents on the road. Of course, when we get the congestion that Athens has today, that fleet average velocity decreases. But still, there are so many crashes that relate to behavior that we haven't yet understood. But some 30 years ago, Trikopolis thought that it was something in the mind, in the brain of the Greek, by the way. And I agree with him that this is a behavioral problem, and it has to deal with our understanding of the brain and our understanding to be able to give education to change that behavior in the brain. So more smoking, more cancer. Less education, more abuse, and more violence. You see what's happening in schools, not only in Greece, but all over the world. This violence in young people. And of course, it goes back to the family. It goes back to the absence of resources coming from governments to be able to deal with this kind of violence. And we can also say more weapons of mass destruction, more mass destruction. Higher the use of fossil fuels, the greater the degradation of the earth and pollution of the skies, and there are more pulmonary-related deaths, which is a great public health problem today. In the 1960s, I'm in America, I'm in Chicago, and we have Heinz van Foster in Chicago, visiting us from Austria. We have Jay Forrester, who was the mayor of Boston and became professor in the Massachusetts Institute of Technology, and gave us models of our Earth through computer simulations that actually predicted about now pollution will be so great that we will be running into greater problems. Health problems are distributed between birth and death. And of course, I think we can think of, for example, Vladimir Nabokov, who actually, he was the Levita, for example, but he discussed the number of heartbeats that exist in one lifetime between the bridges of birth and death, and talked about the problems that are distributed along that path, and of course came up with the conclusion that the birth holds no trauma, which is not correct, and we are traumatized more by death at the end of that. And Stelios Kazantzidis explains this in his song Life Has Two Doors. One door you come in, and one door you come out. So health problems from birth to death, we need public health policies, we need services, but the worst scenario is war, and it's despair, which was never better expressed than by Aeschylus. Pain so intense, not forgotten, even in sleep, falling from the heart, drop by drop, until in our despair, against our will, wisdom comes through the terrible grace of God. That wisdom is philosophy, which is being set aside in Greece, which is the birthplace of Western philosophy. It's not the only philosophy, as you, Katerina, pointed out. And of course, there were overlapping times then between Socrates and a little bit before that, Confucius. maybe 100 years or so difference between them. I don't remember the exact dates. So together with wisdom of philosophy, the golden mean, which can put a brake on consumerism, which itself is a threat to public health, to health of the population, and hygiene, goddess of public health, that combination can provide a road to health and a road to peace. In Greece, in 1821, we had the beginnings of public health thinking with Capodistria. It took 100 years between Capodistria from Corfu and Venizelos from Crete to put together a policy with respect to public health. Venizelos, in doing so, gave Greece access to what was happening in the world. Not that the Greek scientists of the day, Constantine Savas, Constantinus, I've forgotten his name at this instant, I said it earlier, and Coponarius were three giants of public health in those days who pushed for public health, and Cardamaris was the one who was writing on several occasions to Venizelos, and finally in 1929 we have the School of Public Health, which became part of the Greek culture, and in 2019 it was destroyed by an act of parliament and shut down. It still exists as buildings on Leophorus Alexandras, but it has been incorporated into another university, which is very good for the students because public health education continues. But there was no consideration for the tremendous work of that school, in which it had, for example, eradicated malaria. It had brought tuberculosis under control. It had developed policy. In the next 40 years of its life, because it happened to survive, it survived the Great Crash. It came about in 1929. The crash destroyed many, many things, but the school, because of the great needs for public health, survived. And over the next 40 years, life expectancy increased by 20 years. That is, it went from about 50 on the average to about 70 on the average. Maternal mortality fell. Infant mortality fell. Infant mortality was extremely high. Unfortunately, at this moment, there seems to be an upturn again, and infant mortality is moving upwards. Life expectancy is going downwards, but these are long-time constants, and therefore we can't see things clearly. Returning to where it started, Homer gave us the first ever description of an epidemic that swept through the Greek ranks outside the walls of Troy. It was thought to be malaria. Heracles was thought to clean up malaria from the swamps in the stories in mythology. And of course, Homer gave us the Trojan horse. Troy was destroyed towards the end of the Bronze Age, and great civilizations of the Aegean and the Near East unraveled and cataclysmically collapsed. Athens survived, but in poverty. You mentioned that Socrates, his two, what shall I say, the two evils for Socrates was poverty and the other side of the coin, which was richness, which gives rise to consumerism. The Greek Dark Ages, whose cause is still obscure, but we know a lot about those water people who came in boats, maybe Phoenicians, but we do not know too much. We do not know enough about how the civilizations collapsed. And that would be very useful for us today, because there are those who feel that our civilization is now collapsing. Moving on to the 6th century AD, Justinian ran into the plague. 1/3 of the inhabitants of Constantinople and 1/4 of the total population within the empire died, perished, while half of the population of Europe was affected by outbreaks that continued over the next 200 years. European population was significantly reduced as a result of the Black Death, which killed 25 to 30 million people. It resulted in peasant uprisings, brought feudalism to an end, and was a boon to the Ottoman encroachment on a weakened Europe. To protect the city from the bubonic plague, Dubrovnik introduced one of the most important rules, measures for public health, which of course is quarantine. Cholera came into Europe down the Silk Road, which started in about just after the turn of the millennium from Beijing. The Silk Road developed, it's developing in different ways with the China Belt and Road project, but it is causing various health problems. And I have a Chinese student at this instant from northern China who is looking at health on the Silk Road historically, and health on the Silk Road and the needs for health today. So we have quarantine. And quarantine, of course, is being kind of challenged because of COVID. There were good measures and bad measures with respect to COVID, but COVID took away a large part of a population. In our more modern, also in modern times, we had the Spanish flu that covered the globe, killing 50 million people. And of course, we had conspiracy theories because it took place just after World War I. And so one of the conspiracy theories with respect to cause, that it was caused by German agents. The other, because aspirin came out of Germany, it was caused by the widespread use of aspirin. I'd like to give you a little dialogue that goes to Capodistria, if I can find it. A little dialogue from the film Capodistria. If we don't learn from the past, we will pay for it in the future. We will relive it, and then the price will be much greater. And someone in that dialogue says, we have vision, most probably the government. We have. What do we have, though? And the one who replies in the film is War. War replies, you have me. You definitely have me. And suddenly the door bursts open. It bursts open with a bang, and the farmer enters, and in a voice that fills the room, I come with the tractor, not for dialogue, but to live for survival. In Geneva, I discussed 4 Balkan leaders who have had a relationship to public health. I've mentioned one, Capodistria. I've mentioned the second one, Venizelos. Count John Capodistria first attempted to organize public health after an epidemic of cholera. A century later, 29, a little different Greece, the Hellenic School of Public Health was born. Its logo was the daughter of Asclepiads, goddess of health. Its inscription, it no longer exists, this school. It's been, of course, there are students in public health, but the culture has been slipped through the cracks of polarization of Greek and, of course, the disunity and perhaps continuation of what some people believe is a continuation of the civil war in Greece. It says on the parchment, in the absence of health, life suffers. I believe that that comes from Disraeli, but I cannot prove that. That is my theory, my hypothesis. It may actually go back to some ancient Greek saying. Venizelos gave us 2 schools of public health. He gave us one in Smyrna, which didn't last long, and he gave us one in Athens that started finally in 1929 and came to an end 90 years later in 2019. The great mathematician Kara-Theodori, we can say in English, but it is Kara-Theodori, met Venizelos around about 1918 in Crete, and they struck up a very good relationship. And when Venizelos wished to develop education and the universities and a university system in Smyrna, it was Constantine Kara-Theodora who accepted his invitation and came to Greece, and they discussed the founding of a Greek university outside of Athens, and that was in Smyrna. And even submitting a memorandum on the subject. He undertook the organization of the university from scratch, deciding on its departments, curriculum, and teaching staff. He chose several recognized scholars of Greek descent from foreign universities and was himself to be the professor of mathematics, one curriculum related to health and to public health. However, the plans for the university would never materialize, as the Turkish forces advanced, pushing back the Greek forces and taking over Smyrna in September 1922. During the Smyrna catastrophe, Kara-Theodora was able to salvage documents and books which he had personally brought to the university library. It was a terrible time, as you know, but I won't go into that. Not too long ago, I had the opportunity to review a book and propose the Greek author of that book, which is a kind of a dream book of what happened to his great-grandmother, who they never found out, but obviously she died in Smyrna. And I was able, because I have that, what shall I say, I am permitted to propose Nobel laureates, and I proposed him for the Nobel Prize in Literature. Obviously, he didn't get it. He's not the only one, the greater one. And my friend Nikos, the great one, round about 1919, the author, maybe the first president of the Athens Academy. I can't think of his name at this instant. Great Greek writer. He was turned down, and of course later on Kazantzakis did not get the Nobel Prize. The third person I mentioned was Andrigis Stampar, and again there is evidence that Stampar, when he was in Athens round about 1929, met with Venizelos, but I have not found the information in Greece. It has been suggested to me in Zagreb that this possibly took place, but I'm still looking into it. In any case, Stampar introduced the Kentucky closet to Yugoslavia. He was called the Bear of the Balkans. He was called the Hercules of the Balkans because he attempted to eradicate problems of health. He told us that governments are in the hands of bandits. He told us that malaria eats up populations and you can find those populations in cemeteries instead of walking around on the land that belonged to them. And he had a humanistic philosophy of life, and they are found in the Magna Carta of Health, a preamble to the Constitution of the World Health Organization. His politics were the needs of the people. Like John, who again, I can't think of his name, the fly of Greece, who also had the same concept and also saw the difficulties in Greece, the John of Greece now, who saw a burning forest of disunity in government, of polarization, and the very great difficulty to develop public health. Stampa was dismissed by a king for incompetence, by the way. I think he was Alexander, the king of Serbia at that time. He was dismissed for competence, and he was exiled. He was exiled into China, where he told Chiang Kai-shek personally to his face, "You can't bring peace by shooting guns. You need health. You need public health," and there were great floods in China at that time, and he participated in the development of health services in China. He was disparaged, and he was honored in Serbia. He was disparaged, and what happened? He was much loved, and the word that got into the Croat language was that Stampa, his name, Stampa Filia, much loved, Filia, Stampa Filia, using the Greek ending Filia after his name, much loved. And also Stamparophobia, which is slightly pronounced different in the Croat, Stamparofovica, much feared, and a number of other words that got into the Croat language and still exist and still are used. A term, Stamparism, is an indication of Stampa's ideas and principles are being followed. And in Europe, in the Association of Schools of Public Health in the European region, we make great attempts to make sure that his approach to public health was undertaken. And at that time, in 1992, I inaugurated what today is the most prestigious prize, global prize in public health. At that time, I did my best to promote a second prize in the name of Venizelos, but I didn't get much support in trying actually to do that. The one of his early sins of Stampa was to reject military recruits based on their poor health, for which he was sent to Mauthausen as a doctor of the notorious prison, because he refused to conscript young people who were unfit for warfare. In a little bit earlier, just as an historical reference, there was the Boer War. And in the Boer War, as you know, the British confronted South Africans. The South Africans, together, they took down a race, essentially. And at the end of that war, it became clear, just like at the end of the century, after the Balkan War, it became clear that many of the recruits had been unfit for service. The Boer War is much more clear. It was unfit for service, and the doctors pointed this out, the public health people. And this was the beginning of the welfare state, by the way, because in 1904, 1906, the welfare state took its first step in Britain to develop school meals for children to improve their health. And we know at a later date when polio came back to the Balkans not too long ago, and there was a dispute between Albania and Greece. What happened was that Albania blamed Greece, and then Greece, of course, blamed Albania for the outbreak of measles and the outbreak of polio. It only occurred in northern Albania, but this was the result of poor nourishment for children, and therefore the concept of nourishment of children became a major public health aspect. And of course, the technology that we have for this is the Mediterranean diet. The Mediterranean diet is perhaps the best in the world for nourishment of the overall population and with respect to children. So let's keep that in mind. The final person who I spoke about in the United Nations and put forward a resolution on this individual, which was endorsed by the meeting, and the proclamation, no, it wasn't called, the resolution will be presented to the United Nations by me through the World Philosophical Forum in the new year after some refinement of the document. It is to resurrect another forgotten person, that is Nicholas Tesla, who also gave a lot to the world, as you know. And therefore, we are asking through the World Philosophical Forum, which has a very well-developed relationship with Serbia, to actually recognize a day for Nicholas Tesla this coming year, commensurate with his birthday, which, if I remember correctly, is the 10th of July. How am I doing on time, Katerina? Because how much time do I have?
5 more minutes, okay? Because 5 more minutes.
Thank you.
Is
That
it
will be
okay?
fine. That will be fine.
Wonderful, wonderful. Thank you.
Thank you. When I sent my abstract in, I was going to talk about transportation and the needs of.
Well, it relates. You can't travel when you're going to get sick or when you are sick already because of a pandemic of any type.
That is correct. And of course, there was a time when people were on the move. They were nomads before man settled down, and the virus that existed then and the bugs and what have you followed them. And then, of course, they settled down and we have urbanization. And so the viri come into the cities. And so movement either way, we have problems, and we need to develop an interest in public health related to transportation. It exists. One of the first schools in the United States actually was set up because of the needs of public health of sailors. Sailors, this is a workspace, and workspace health is a major part of public health today. There are now a number of articles with respect to Tempe, because workers were also killed in the train besides passengers, 57 young people who lost their lives. But it calls attention to the workplace and to the threats that exist in the workplace. And on trains, it's the crash. And those in Austria also, at a little later date, Austria developed schools of public health with respect to trains for the sanitation of trains. But it also was that the trains from Vienna would take rich people, aristocracy, to Pula and to other parts of the coast down the Ionian to go to spas for their health. One of them was tuberculosis, and of course Chekhov was in Pula and in health spas as a result of tuberculosis. But it also attracted the celebrati. For example, Beniamino Gili, the great Italian tenor, sang there. Of course, it was in accompaniment of the spa. This was a very luxurious situation, but we had to have health and sanitation of trains. They were running on rails. They were taking people distances, and they were taking them for various reasons. In this case, to a health spa and a wonderful time. But those people were sick, and they were not having really a wonderful time. It also was trains that took soldiers to the front faster. It was also trains that took oil from Romania to Germany, from Romania to Germany to supply the war machine of the Nazi regime. And I think I will end on the note here, saying that the use of starvation, for example, has been used recently. It was used in Syria by the Syrian regime to prevent supplies getting to the northern part of Syria, and therefore affecting the health of the people who were living life on hell on earth because of the war that was going on. So going back to Germany, the denial of medical aid and the forced displacement, that also occurred at the time of the First World War, but war and the Holocaust of World War II. Hitler, as a dictator, yes, democratically, I call him a dictator, democratically voted in, certainly. He subverted public health and its institutions to instruments of death. The public health culture of Germany that actually was given to the United States when they developed the first school of public health with respect to shipping and public health of shipping, Germany had a fantastic public health culture. Greece had a reasonable public health culture through the School of Public Health, which was closed in 2019. And of course, Hitler relegated the work of German philosophy to the rubbish heap. Without philosophy, without the golden mean, without public health, we cannot have a healthy population, which is the basis for development, and it is a catalyst for peace. Thank you.
Thank you very much, dear Professor Jeffrey Levet. Very impressive, all this information and major milestones and the contribution of Kapodistrias, of Venizelos, the present situation, Kazantzidis, let's not forget the artistic element. Έχουμε και την ποιητική λήξη του συνεδρίου μετά the poetic closure of the conference. Δεν πρόλαβα και παρέλειψα να σας προλογίσω. You are the founding dean of the National School of Public Health in Greece in 1994.
Correct.
Πέρα από όλα τα πολύ εντυπωσιακά τιμητικά, you held positions in information engineering που έχει να κάνει με το πώς πρέπει να προωθείται η πληροφορία και η γνώση. Πώς για να είναι αποτελεσματικό. Αυτό είναι πολύ σπουδαίο. Biomedical engineering. Να βρούμε κανένα καλό, τι να πω, ιό που να μας κάνει καλύτερους ανθρώπους, αν μπορεί να βοηθήσει εκεί πέρα. Where is the virus of virtue, μήπως μπορούμε να βρούμε κάτι να φτιάξουμε. And physiology, with teaching hospital experience as chairman of biomedical engineering. Είναι πάρα πολύ σπουδαία αυτά και ότι προφανώς γνωρίζουμε όλοι πρώτος εσείς και πώς η υγεία είναι το θεμέλιο και να πούμε για οτιδήποτε άλλο συνήθως is a prerequisite και η φυσική υγεία βάσει και της ψυχολογικής, αν υπάρχει διαφοροποίηση και δεν είναι βιολογικά φαινόμενα όλα. Να μην παίρνω εγώ το χρόνο. We have time for discussion and questions. Και άλλα πράγματα να μας πείτε εδώ πέρα, σίγουρα παρέλειψα. Βρήκα, you participated in the Council of Europe and the World Health Organization on vulnerability reduction through public health. And you have written major declarations, the Skopje Declaration on Public Health, Peace and Human Rights, December το 2001. Να μην λέω εγώ, θα τα στείλουμε αυτά. Σας ευχαριστούμε κύριε Λεβέτ για όλα αυτά που κάνατε. Πέρα από τη συμμετοχή σας και την καλοσύνη και τη γενεοδωρία σας. Ναι, Δημήτρη. Ναι.
Ήθελα μόνο να πω ότι ξεκίνησα την καριέρα μου στην Ελλάδα περίπου το έτος 1961 και ήμουν στο νοσοκομείο Δαφνή.
Τι λέτε, αλήθεια, το Δαφνή, το Δαφνή που λέτε.
Και αρκετά χρόνια μετέπειτα η πεθρουλάκι μου, πεθρουλάκι μου είπε ότι δεν θα έχω πρόβλημα στην Ελλάδα, διότι ξεκίνησα, έτσι μου είπε, στο τρελοκομείο που είμαστε.
Πολύ καλό, πολύ καλό. Ναι, 1965 στο Δαφνή. Ναι. Και ο φιλελληνισμός σας επίσης και όλη η γνώση του πολιτισμού. Να είστε καλά, άλλος ένας φιλέλληνας. Μπλέξατε κι εσείς κύριε Λεβέτ. Αλλά τέλος πάντων ευχαριστούμε την κυρία Κρανιδιώτη πάντα, τη μαθήτριά σας και καθηγήτρια εγκληματολογίας που μας έφερε σε επαφή. You taught her well and then she repaid you. Δίδαξε και εκείνη.
Teaching me well. In all matters, Greece, making up for the loss of my wife, who is no longer teaching me anything, but I remember everything that she taught me.
I'm sorry, μάλιστα. Ωραία, έχουμε ερωτήσεις εδώ, Δημήτρη, ο κύριος Ναλμπάντης.
Good afternoon, Professor Levet. I appreciated personally the presentation. It was for me a revealing moment to understand the importance of public health. I never thought of it in such a way. You made a very good presentation of what are the benefits and what is the importance of public health for a society. I don't understand why the society, our society in Greece or more in general, or specifically in Greece, and its representatives, its political representatives of the society, don't recognize such an importance. Or is it because it is costly? Is it because that the public health policies don't bring immediate results? What is the reason we don't pay attention to this important issue?
I think it's all of the above, but I would like to stress that public health is a difficult terrain. It's more difficult than, for example, societal engineering, which is engineering based that you spoke about, Katerina. But they have common goals in the sense that the quality of life would be improved by these initiatives, either in public health or societal engineering. And some people today speak of societal engineering as the new public health. It covers the individual and the population, both societal engineering. But I think the difficulty is a conceptual one. There is also a difficulty because there has been a kind of a, what shall I say, tension between medicine that can make money. Okay, and there's nothing wrong in making money in the right kind of way, and public health that does not fit into any economic model that enables you to make profit from it through business. So that is one. There are also many levels of understanding of public health. It can be understood philosophically, and one of the things that the World Philosophical Forum is interested in doing is developing some kind of platform that gives us a more philosophical approach to health, to public health, and that is difficult. It is also difficult, I think that you mentioned one, by the time public health will have brought rich dividends, as Stampa said, Stampa, one of his sayings, elections have come up, and therefore it is better perhaps for them to support medicine, as Nixon did. Nixon supported and gave great impetus to cardiology. There are other presidents who have given great impetus to cancer. This is very important. But nevertheless, they have set aside public health. And there is one very interesting vignette episode in the American Congress, round about 1960s, thereabouts, perhaps a little bit later, in which the setting is such that Donald Anderson, the man who eradicated smallpox from the planet, who saved millions of lives in doing so, sat in the Congress, no one speaking to him, with his notes, waiting to go into a hearing on health. And in comes Denton Cooley, a great surgeon, yes, a great surgeon, a fantastic surgeon. I had friends surgeons in open heart surgery who were friends of Denton Cooley. And I was the director of an interinstitutional institute of cardiology at one point in my career. So I knew these people, and he came in. He had perhaps saved 1,000 people as an open heart surgeon, perhaps, and we cannot show that they would have done less better without the surgery than having had the surgery, but it cost a lot, and it was a demand, and it was within the purview of the people who wanted to have that surgery and were able to pay for it, or to be paid for by the state. So I think that this is another thing, but the Congress persons, all of them, rushed to Denton Cooley. He was in a white coat, the white coat syndrome. They kissed his hands, and they led him to the place where he would sit for the hearing, and then remembered to bring Donald Henderson, a wonderful man, a great individual who had eradicated smallpox on the globe. This, I think, is also another obstacle to the development of public health. I'll just add one further. I don't want to monopolize the time, but I think public health has a responsibility as well, in the sense that we haven't managed, maybe artificial intelligence will help, we haven't managed to give politicians simplified algorithms so that they can understand better the contributions that public health can make to society. But they cannot ignore the history, which they have, that in Greece, with the closing of that institution on Leoporos Alexandros, as the school, the National School of Public Health, that I was the first dean of, they ignored the history of Venizelos and all of the trajectory that brought us up to 2019. And there had been many attempts, because of all of the differences that your question raises. And I remember your face, by the way, very well, and the problems that I had with your name 2 years ago, I think. Not deal with the concept of public health. They are dealing with other things, and I don't want to go into that.
Thank you very much. Clear.
Πολύ ωραία, ναι, όσο καλύτερα the better we understand or we're starting to have some insight on such matters. There is hope, and there is hope that such scientific fields exist and represented in Greece, even if through a philhellene. All these things require a lot of not only hard work, but all types of difficulties, as you know much better than we do. Έχουμε άλλη ερώτηση, παρατήρηση. Θα έχουμε και το διάλειμμα τώρα. We have the coffee break, but no coffee, so θα κάνουμε μόνοι μας καφέ, τσάι στο σπίτι, until we are able to meet again in person. Πάρα πολύ ωραία, κύριε Λεβέτ. Αυτά είναι εξαιρετικά και very promising. Που λένε the description of the problem is half its solution ή κάτι τέτοιο, τέλος πάντων.
Thank you very much for
Εμείς
your
ευχαριστούμε
patience.
always, κυρία Κρανιδιώτη, πάντα
Thank you
ευχαριστούμε.
for taking the time to listen to me. I really appreciate it.
Εμείς ευχαριστούμε for taking the time to deal with these matters all these decades.
And Merry Christmas.
Merry Christmas, βεβαίως. Εδώ έχουμε και δέντρο εμείς, μην νομίζετε. Εδώ. We have the Christmas movies here.
Oh, wonderful.
Ναι, Δημήτρη.
Can I ask another question, because I'm ignorant? I mean, is there a specialization of public health doctor in the medical system, in the medical schools?
Yes, there is. The kind of the bridges that exist between public health and medicine, I'll just point out one, is primary health care. I'll point out another, actually childcare. And also now, because of the aging process of societies, the changes of demography, we have also in the upper ages, in my age bracket, for example. So the bridge produces primary health care physicians that are frequently thought of as public health doctors because they are close to the community. We also have doctors who relate to emergencies, so that, and we're dealing with crises, and if we look at Greece, the number of crises that have taken place from the flooding in Mandra to the fire in Mani, to the fires in Mati, to the train crash in Tempe, points the need. And not too long ago, the the magazine of hygiene that is published from Salonika, I believe, from the north of Greece, points to these particular needs of Greece, but they are relating it to the workplace. So there have been written, just like in medicine, the competences that a medical worker requires, whatever his level is, there are just as many competences that have been put down by the Association of Schools of Public Health in the European region and its kind of evaluation office. Let me put it that way. I don't remember the name of it, but we have lots of competences that you can pick up. And if you're teaching public health, you have to look into those competences because you can help young people who are studying or thinking direct themselves in a particular way. Do they want to be doctors in a hospital? Do they want to be doctors in the community? Do they want to be specialized in disaster medicine? Do they wish to be involved in brain research? There are so many things. And this is another of the problems that was written up in one of the top American newspapers that I responded to, but they never got back to me, in which they say that public health is too wide, and therefore we will never able to get our arms around it. Something like that. Okay.
Πολύ ωραία. Οπότε ευχαριστούμε πάρα πολύ για όλο την παρουσίαση, για όλο το έργο, την ποιότητα γενικά. Και θα προχωρήσουμε τώρα σε ένα διάλειμμα 10 λεπτών και επανερχόμαστε με τη μουσική λήξη. Θα προσθέσουμε τον Καζατζίδη απλά εμείς μετά. Πολύ ωραία, πολύ ωραία. Η πολύπλευρη αντιμετώπιση